Um, Hello everyone. So this is just a small guide to the radiation oncology PGs, like the PGs who have just entered the residency. So I'll just be starting with the introduction to radiation oncology, how the basics that you can know or learn before entering radiation oncology, workflow in radiation oncology, books that you can follow, websites and YouTube channels and apps and Insta pages that you can follow. So, starting with the introduction, I'll just be telling that oncology is composed of like surgical oncology, medical oncology, and radiation oncology. It's usually a multimodality treatment for any cancer. It's a multimodality treatment. So, surgical oncology, as the name suggests, it mainly deals with the surgical aspect. Medical oncology deals with the systemic therapy like chemotherapy, immunotherapy, and targeted therapies. Radiation oncology deals with the radiation part of using the radiation to kill the cancer cells. So, surgical and medical oncology is usually a local therapy, and medical oncology is a systemic therapy. So for example, if this is a lesion here, if you operate and remove either you treat it locally, so either surgery or you give radiation and then treat the tumor over here. These both are local treatments. And medical oncology, where you use systemic therapy like chemotherapy, immunotherapy, these are all systemic therapies. In some of the countries, medical oncology and radiation oncology is learned as clinical oncology as a single branch, and some in countries like UK practices it as clinical oncology. Now, radiation oncology mainly deals with using radiation to kill the cancer cells. The basic radiation modalities that are used are X-rays, gamma rays, and electrons, protons, neutrons. Nowadays we there is also carbon ion therapy, like heavy ion therapies also, which are coming up. So this is just an overview of radiation oncology, just the basics. And the basics that you can learn is I would like to tell that it is anatomy, which is very very important, mainly the radiological anatomy, because we contour the OARs, in the sense the organs at risk near to the tumor, so that they receive lesser doses. So your radiological anatomy has to be strong when in radiation oncology. And basic physics like electromagnetic radiation, the parts of the atom, protons, neutrons, and electrons, all of the just the basic stuff. You, if it's better that you know it beforehand, and later you can build up the rest of the medical physics based on that basics. Obviously, clinical skills, some of the PGs think that it is a non-clinical subject, but no, it's a clinical subject. So you will be doing upper vaginal examination for cervical cancer, endometrial and cervical and vaginal cancers, PR for rectal cancers, breast lump examination, oral cavity examination. All of the examinations are important, and you will learn and you will have to do all of these things. You would have learned PS, so per vaginum examination in your gynae postings, oral cavity breast examination in your surgery postings. So that will be helpful. So I'm just telling that these are the basics that are required in radiation oncology. Before entering the radiation oncology, it's better you make sure you have these particular skills. If not, you can learn. That's not a problem. Coming to workflow, you will have to start when a patient comes. You will obviously start with history taking, then you will do a detailed clinical examination, then you will follow it up with investigations like biopsy, imaging. You will stage the disease, tumor board discussion goes on, and then management is usually multimodality treatment with like for example, if there is a breast lump, there is breast conservation surgery followed by adjuvant systemic therapy followed by adjuvant radiation therapy. So the most see, you can see it is a multimodality treatment. All the three modalities are included. Now, for example, if I go in detail about radiation, like first, like we'll ascertain the indication for radiation, the dose that you want to give to that particular patient. It will The radiation part per se is starting with immobilization of the patient, so that the patient does not move during the treatment. Simulation, so that you can simulate the same thing, the same treatment environment before the treatment itself, so that you can be sure that the treatment that you are giving is accurate. The technique, that is 3D, IMRT, VMAT, SRT, SBRT, and protons. Whatever technique that you are using, you have to ascertain that. Treatment, target volume delineation, organ at risk contouring, normal tissue tolerances, all of these you will learn eventually. This is not required at the initial stages, but you just need to know this is the workflow that happens. Then there is treatment planning, which is done by the physicists, medical physicists. Then you will evaluate the plan, then you will execute the treatment plan, like you'll give the treatment to the patient, and then manage those toxicities. The ward treatment, the ward toxicities management on oncological emergencies is very important. You need to be strong in managing those, especially the electrolyte imbalances that happens. And books that you can follow for medical physics, we have Khan's. This is the gold standard. You can't escape, you can't tell that it's not, even though it's difficult to follow to most of them, but it's the standard and you have to follow this. There are other books like Siptian's also is there, the physics for clinical oncology, which is more simpler. Then if the Khan's book is too tough, you can follow the Khan's lecture handbook, which is but the very simplified version of it. And starting for radiobiology, we have Eric J. Hall radiobiology, and there is also basic clinical radiobiology book. For cancer biology, Lauren Pecorino, the molecular biology of cancer. And for clinical and or radiation oncology, the basic standard textbooks are Perez, which is important, Gunderson, which I like the most, Devita, Walter, and Miller. These are the main four textbooks that I followed, which are standard. You have to stick to one standard textbook, and then follow with the other smaller books if you want, but one standard textbook is a must. You have to follow either Gunderson, either Perez, or Devita. Other textbooks that you can follow is this basic radiation oncology, pocket radiation oncology, absolute, essential, and then there is MCQ based review also. There are many more smaller textbooks which are available like this. These are just, you can use it as a reference. And apart from that, the other things that you can follow are websites like RadOnc Review, clinicaloncologyregistrar.com. Apps that you can follow is RadOnc Tables, RadOnc Calc, and OncoAssist and NCCN guidelines. These are the ones which I followed. You can also follow them. And YouTube channels, these are the YouTube channel that I follow: Forum of Radiation Oncology, Young Radiation Oncology Club, Oncology Classroom, SORO, Oncology Academic Forum. I also follow Professor Rajiv Sarin's YouTube channel as well. And I think my channel is also is what, if it's useful, you can follow that as well. For Instagram, Instant Oncology is the page that I followed and I found it very helpful. That's it for this video. Thank you so much. And if you have any other sources that you can that you have been following, please comment so that others can note it down. Thank you.